thank you all in this very important conference. Impact of the war on health professions education. The co-authors are Dr. Abualaz Hassan Ibrahim. He is the head department of community medicine in our faculty. And Hashim Gebril Teeso, he was the head department of surgery in our faculty. Walleed Hamza, assistant professor in the department of medicine. Dr. Zolnon Mohamed Gebril and Dr. Tagwa Saeed are participants in the education process. They are not staff. The impact of the war appears here in the distribution of the co-authors. Dr. Abualaz is in Cairo. Hashim Gebril and Walleed Hamza are in Somalia. Zolnon and Tagwa are in United Arab Emirates, and I am in Oman. Our study is a review in the form of case studies exemplified by the University of Kordofan, literature reports, and expert insights. In the data, some of the papers represented our study. Around 70% of the population in Sudan now the population currently is about 51 million. 70% of them are in need of humanitarian aid. Around 10% are displaced inside or outside the country. Can I see the next slide? Yeah. The study concentrated on the impact of war on health professions education in Sudan and the suggested strategies for rebuilding health professions education and the challenges facing the implementation of these strategies. We will start with the impact of the war on health professions education. Disruption of educational infrastructure, mainly the physical infrastructure, and this has been addressed generally by the first paper presented by Dr. Nadir. There is extensive damage in the universities and medical schools, teaching hospitals, halting health education and training of students and postgraduate staff, military repurposing of these buildings, educational spaces converted into munitions depots, and sniper positions for the higher buildings. Impact of military stages leading to shortages in essential supplies and crippling healthcare services. Loss of clinical training. Clinical training has been very much disturbed by the damage of the hospitals and the damage of the universities, and by the displacement of the staff and students as well. The burden on human resources is great. There is loss of skilled educators. There is brain drain phenomena. Most of the staff went out of the country and they have been involved in providing services outside their country. Overburden remaining staff has been very much exhausted and underwent a great reduction in their production because of being very much exhausted and overwhelmed. Disrupted academic leadership has been done. Some of the dean faculties left the country. Some of the leaders, head departments, and so on also left the country because of this devastating war. Isolation from international support was there because of insecurity, and the war itself is ongoing. Yes. Curriculum delivery has been very much interrupted. Widespread suspension of face-to-face education. This has become very difficult in the classrooms and the hospitals. Inadequate virtual alternatives are also affected because of lack of power and weak internet coverage. Compromised skill mastery. The students face the graduation without mastering essential clinical skills. The sort of training is changed and deteriorated. Disrupted educational structure and long-term impact on healthcare quality has been faced through now the war is taking place in Sudan for more than 2 years. Can I see the next slide?
Psychological impact already.
We address the psychological impact separately because it is a very important effect and impact, and it is very disastrous. There is widespread psychological trauma to the human resources, to the staff, to the workers in the university, to the students. There is anxiety, depression, burnout, and post-traumatic stress disorder. In spite of lacking experts to deal with this, you see in the whole of Kordofan, there is no psychiatrist, there is no consultant psychiatrist. Only psychologists are dealing with these problems. Some of the patients need psychiatrist treatment. There is no way, and you can't refer them to any other place because of insecurity. In adequate psychological support, already we have no psychological support in our faculty. Loss of life and injury. I know a lot of staff in the area in Kordofan who has been killed. Sometimes some of them with their children, and a lot of students, males and females, have been killed also during this war. Educators and students are equally traumatized, and there is weakened educational environment overall. The strategies for rebuilding health professions education. Infrastructure rehabilitation. It can be a rehabilitation, rebuilding, or construction. Strategic public-private partnerships. Actually, this is very much needed in the recovery period. Regional and international academic collaboration is also important. Community involvement and engagement is essential. And the Sustainable Development Goals planning to maintain health professions education integrity through consistent financial and technical support. Regarding the human resource capacity building, strategic recruitment and retention plans are important. Continuous professional development is essential. Safe and supportive work environment is needed. Engagement with diaspora experts is very essential and very important. Collaborative efforts and national and international partners are very important. Curriculum delivery and digitalization include curriculum reform, integration of digital tools, flexible curriculum design, that is crisis and emergency responsive curriculum, competency-based assessments and competency-based education is also essential, and crisis responsive content is very important. This part of the presentation, this slide is very important, including student motivation and support during the war, especially comprehensive mental health support, mental health education integration student-centered support system rather than facility-centered systems. Strategic partnerships are very important with the community, with the local government institutions, and with the private sector. Community-based initiatives and community engagement is very essential. Adoption and acceleration of health professions education related goals are very important. They need to be aligned with the global goals. We mainly work on Sustainable Development Goals 3 and 4, but also 5, 8, 10, 16, and 17. 17 partnership is a very important goal. Digital transformation and innovation to fill the gap in face-to-face education. Human resource development is very important. Community-oriented education involving Sustainable Development Goals 3 and 10 will focus on community-based learning and reducing inequalities. Strategic partnerships are important, as I mentioned. These are the challenges. I will summarize these challenges in main 3 points. That is a financial problem, the leadership problem, and the partnership problem. In conclusion, this war is very devastating, and it has a very negative and destroying impact on healthcare profession, on health professions education systems and institutions. We suggested strategies to overcome these and to repair these impacts, and challenges facing these strategies are needed to be overcome. I say the words of mine, and I ask Allah forgiveness and for myself and for you, and thank you very much for your attention.